going to go run through a quick training, and then afterwards, what I like to do is have some time for Q&A, okay? So what I wanted to go through is what is a data-driven approach to actually prevent? What are some data supplementation and minerals that really can prevent cold and flu and can also treat early symptoms of cold and flu? And I think data is really important because so many people say certain things are good, but I really want to talk about what works with data. And there's a difference between prevention and also symptom treatment. I think that you have to categorize them differently. Some things can be used for both, but some things are specifically just for prevention and some things are better for symptom treatment. If you go to our website, drmaggie.com, and you go under featured packs right there, you'll be going to the screen. And I have all my recipes here. So anybody asking me about doses and stuff like that, it's all on here. My actual recipes are in here, and it's right up there. So you can actually click. You can go to prevention pack for adults and click prevention pack for kids. This would be symptom treatment for adults, symptom treatment for kids. So I first want to go over what are some prevention things that can be do for adults and any children, like I think 10 and over or 70 pounds and above. I have a core pack that I recommend, okay? What is the core supplements that I do recommend would be a couple things, is that vitamin A, okay, has been shown to be amazing at dealing with the mucous membranes of cells. So what we're finding out now, like the vitamin A of 10,000 every single day is incredibly useful for helping people deal with leaky gut. But vitamin A also, because it helps with the mucosal lining, it's really great for the back of the ears, nose, and throat, which is where upper respiratory infection hits. So taking vitamin A of 10,000 a day would be great. And then also the other piece of it is vitamin A has separate activity to actually help support the immune system against viruses. So you actually see some vitamin A being used in some antiviral regimens for certain types of viral infections. So there's multiple reasons why, and vitamin A is cheap. This is a very good quality vitamin A, and there's you only have to take one a day for prevention. What I personally would do, I would take one a day for prevention, and I would take this daily. If you're trying to prevent upper cold and respiratory, or if you're immunocompromised, or if you're exposed to any sort of high-risk situation, I definitely would take this on a daily basis to prevent, especially during this challenging time right now. Vitamin D is the second thing, and my recommendation for adults and kids over 10 is 5,000 IUs a day. But vitamin D clearly is antibacterial. There's a lot of data to actually show that it helps support a healthy immune system, which is why it's outdoors and sunlight is so helpful. So simple enough, you want to take 5,000 IUs a day of the vitamin D. This is a capsule. In the kids section, we have drops. Each of those drops is 1,000. So for adults, I would definitely go with 5,000 IUs a day, and that's daily. And I think you should take that regardless of whether you're trying to prevent cold and flu. Everybody we've tested have been low on D, so taking 5,000 a day is good. But at some point, it'd be good if those of you who haven't been tested to have your doctor test that'd be really great. ProFlora AI is our probiotic. And ProFlora AI actually has several strains of bifido and lactobacilli that are known to improve the growth of other good bacteria in your gut. And specifically, it has a strain called Saccharomyces boulardii. Saccharomyces boulardii is a strain that's really, as functional doctors and naturopathic physicians, really take to heart because it is the best in prevention of infections. So I will take this probiotic, and I'll take it if I'm traveling to prevent traveler's diarrhea, because the Saccharomyces boulardii is so effective at helping protect your gut from infection. And your gut, the lining in your gut is also the lining of your ear, nose, and throat. So definitely, I would say a ProFlora AI, a probiotic like this every day is great. Ultra potency. See, you've heard all in China and in New York now, they're already starting to do high dose vitamin C for antiviral, antibacterial infections. C is naturally boosts what's called natural killer cells. Natural killer cells are the cells in your innate immune system that targets and gets rid of viruses. So it's so powerful that as it can be actually used as an IV drug. right now. And it is, they've been using it in China. They've been using it in New York already. What I do as a prevention on this for adults would be taking about 2,000 a day, like 1,000 in the morning, 1,000 at night. Vitamin C, interestingly, can be used not just for prevention. It's helpful to be used when you have an infection. So what I personally do when I have an infection, any sort of sore throat kind of thing, runny nose, is I take the 1,000 of vitamin C every 2 to 3 hours. I just take one of them. And the thing is, when you talk about high doses like that, where you're talking about 6,000 to 10,000 milligrams a day when you're sick, is that you can't, your stomach cannot tolerate vitamin C at those doses without diarrhea, extreme upset, acid stomach, because vitamin C is very acidic. That's why you want a form of vitamin C that's buffered like this one. This is one of the few vitamin C's that I know that even when I take 10 of these a day, I don't have a stomach problem with it. And that's the kind of doses when you're sick that you need. So this is one of the best forms of vitamin C. There's a run on these. I mean, all over the country, there's a shortage of really good quality vitamin C you can high dose like that. So it's been really difficult, but we've been able, I just got in another 100 bottles because we're just out. And it's like the last 100 bottles for like another 2-3 weeks before we possibly even know whether we were going to be able to get more. So good quality vitamin C, there's a run on it right now. Now, these are the core, but I would definitely recommend some herbs, okay? There are some herbs that have been shown to actually be helpful in dealing with cold and flu. And so when you're looking at it, andrographis, this particular andrographis is really good. Traditionally, this combination of herbs is used in Chinese medicine to actually support lung. So adding andrographis, like one capsule twice a day, like 2 a day, would be really helpful just to add herbals, because you got vitamins over here, but when you have multiple ways to prevent, an herbal support is a good way to add additional mechanisms to be fighting viruses. So I like either, essential defense or andrographis. It depends what we have available. That's why I have both here. I have both here because sometimes I'll be able to get a hold of some of the essential defense. Sometimes I'll be able to get andrographis. We happen to have both. Essential defense is a really great one that has a combination of herbs used traditionally in Chinese medicine as well. And it's very inexpensive. And you would also take, for prevention, essential defense, I would just do 1 a day. It is one that, essential defense is one that you could use for early treatment of symptoms. Because if you look at some of these ingredients, so this is like a mixture of Chinese herbs, including ginger. Ginger, we've talked about the antiviral activity in it, okay? Licorice. Licorice is really strong data to actually show that licorice is really amazing, especially even for symptoms or prevention. There's good data behind ginger, really good data behind licorice, okay? And then these herbs are actually in a combination specifically to work really well together. So this is a good mixture of Chinese medicine herbs. That's really helpful. So essential defense would be, I think, good for prevention, but when we get into treatment, I'll show you how to do that, but it's just 1 a day. Andrographis, if you're going to use that, it's really powerful. It is twice a day for really good for prevention. So this would be what I recommend for prevention. You don't have to have all of them. I mean, if you feel like you need to, I would definitely say the core is going to be your A, your D, your probiotic, and the potency, and pick one of these herbs. If you want something every single day that you're going to take because you're in a high risk category. But if you're like, I just want to add a couple things, you could pick, like you're already taking supplements with a lot of herbs, or if you're already taking D, you want to just add 1 or 2 other things, that's totally fine to do. I like it because the recommended dosages are here. And you can build your own pack because I'm not always going to have these things available. And honestly, we have almost all of these things in a pack called ViroSure, but we cannot stock it. We've sold out all of it. So that's why I've broken it down into individual components where you can build your own kit here right now. But we will get some ViroSure back hopefully soon. And that has like a bunch of things together in one kit. So you don't have to buy 5 separate things. But right now, you can build your own pack in any way you want right here. Okay, now, what are some add-ons? Some things to consider. If you need a multivitamin, buy this one anyway. The reason I like this one is because this minimal essential has good zinc in it. It has a really good form of zinc in there. at 10 milligrams of zinc, which is good. It has copper in there, but zinc and copper are really great at boosting the immune system. It has some vitamin A in there. It's very low amount, 3.76 milligram, but it has everything in this vitamin is actually the best form of it. So all these B vitamins, if you look, they're methylated forms of the B vitamins. So if you're going to take a multi, this is the multi I recommend for people with all autoimmunity. And I also recommend this if you're going to take a multi anyway and you're trying to prevent cold and flu, this would be the one I would choose personally. So that's a multi if you're going to do that. Anyone with autoimmunity, you should be taking about 3,000 to 4,000 milligrams of fish oil anyway, because it's got a huge anti-inflammatory effects and tons of autoimmune calming pathways and hormone balancing pathways. So if you have autoimmunity and you're trying to prevent cold, support a healthy immune system, take a fish oil anyway and get a good one. So this fish oil, I would recommend like getting about 3 in a day. That'd be really helpful. So this is specifically for people with autoimmunity. Add a good fish oil like this. Now, what about people with asthma and allergies, okay, or mast cell disorder? Sinuplex is my go-to. I would say if you have asthma, allergies, or mast cell disorder, I love Sinuplex because it really, the data is so good on quercetin. And it's got quercetin in here, a really good amount of quality quercetin, which has been known to decrease histamine, it's anti-inflammatory, and it's helpful for the mucus layer. So, and then on top of it, look at, it's got additional vitamin C in there. It's got NAC. NAC, the data on cold and flu on NAC is really good. There's strong evidence for that. So I would say that this particular product, the Sinuplex, I would definitely recommend if you're trying to just prevent a flare with your asthma or allergies, I would take 2 a day. You could do together or once in the morning, once at night. If you're trying to, if you're in the middle of it, you're starting to get sick or you're in an asthma flare, I would take 6 a day, 3 in the morning, 3 at night. It works amazingly well. Alumni who are using this for asthma, allergies, mast cell disorder, swear by it, okay? So this works really well and it's cheap, okay? And it's really good quality. So those would be add-ons to consider for special considerations. Now, how do you prevent it? What are some prevention basics for kids? I would say that the same idea goes, but like the D is really important. So if your child is under 70 pounds, I would go with like D in drops, like 2,000 a day would be great, okay? Under 3, always consult your physician, okay? But between like, you know, 4 years old and 12, I would definitely do like 2,000 of the D. I would do the chewable C. I like it because it's 250 per milligrams, and you can chew one in the morning, chew one at night. They taste great. This is the one my daughter's taking because she can't swallow capsules. Okay, so that's a really good chewable vitamin C. And then this probiotic is really great. It's also chewable, and it's got 2 of the best strains I really like to help prevent infection. So for kids going through our program, dealing with gut issues, leaky gut, all those things, this is the probiotic I recommend anyway. So this is just an added bonus. If you're trying to prevent cold and flu, this would be a great one to take for kids. Okay, and it's just chew 1 a day. Now, what do you take if you have symptoms? This is very different, okay? So I want to talk about, this is stuff you should have sitting at home because you don't want to wait. The data shows that when you start these supplements, earliest is better. If you start at day 3, day 4, it's pretty useless. But if you start the minute you have a sore throat, runny nose, you know, or a cough, that's when it's really effective. So Virus Strike, hands down, all right, guys, this is my favorite, okay? And why? Because it's the triple threat. If you look at Virus Strike, right, I look at it as my viral Z-Pack. So because it contains 3 ingredients I love, okay? The evidence with this particular ingredient with Immune Guard and EGCG is insane, okay? This particular plant, the Camellia sinensis, their extract from it, the EGCG from it that has L-theanine, really has been shown to support the immune system. It can decrease the rate of healthcare workers, people getting sick. It decreases the duration and the symptoms of cold and flu. So this Immune Guard ingredient, bar none, is amazing. Elderberry, the data on elderberry is amazing, okay? And I know some of you hear some things about like cytokine storm elderberry. There's no clinical evidence that exists. It's just this theoretical thing. Whereas the literature that supports the use of elderberry and my personal use of elderberry in our program with our clients over the last 13 years is huge. I love elderberry. So elderberry is really great, especially if you start at the first onset of symptoms. And then olive extract, this particular olive extract, such good data on olive extract. So They even showed that for, I think it was the olive extract, where when you, they actually showed that there were people who were taking prednisone, and even taking prednisone, which you would consider immunosuppressed and would have a poor outcome with infection, that taking olive extract was able to actually help even people who are immunocompromised or suppressed on prednisone with cold and flu symptoms. So this is easy to have on hand, guys, and you want it at home, and you want to take one in the morning, one at night, 2 a day for as long as you have symptoms. So if you're only sick for 5 days, then just take it for 5 days. If you're sick for 10 days, take it for 10 days. This is not a product I recommend for preventions. This is a product that's really great for treatment of symptoms, okay? If Virus Strike is not available, I would recommend Pro-Immuno. Pro-Immuno, we're sold out right now, has what's called beta-glucans in it. And beta-glucans has really good data in cold and flu as well. So depending on what we have available, there's going to be some shift in this availability based on this. Right now, we have tons of, we just got 50 boxes of Virus Strike in. So we have that right now. I would get that. That's my go-to anyway and first choice. The other thing must have is zinc, okay? Everything you guys are hearing about hydroxychloroquine and Plaquenil, why it works. There's a lot of theories to it. They don't know for sure, but that one of the mechanisms that hydroxychloroquine works is because it opens zinc channels and allows zinc to go inside the cell. So zinc in data has been shown to decrease viral replication. We know viruses don't replicate as quickly when they have zinc. It decreases that. So zinc does work. And so I would recommend is that when you do get sick, taking zinc, 2 of these bad boys a day would be really great. Okay, but the problem with zinc when you take in higher doses is a stomach upset, which is why this particular zinc has 2 forms in it. The A and G form. And so both of those forms are highly absorbable. So you gotta, the first task is get that quality zinc absorbed into your gut in the first place. And then secondly, you know, it's like, then they can get into your cells. So a good zinc is really important to have on hand before you get sick. Right now, at this moment, we're out of stock. We're getting more of these in stock next week. But we have Zinc Drink, which is the liquid form of the zinc. And 1 teaspoon is the same as 1 capsule. So you could do 1 teaspoon twice a day, which is great for kids as well. So you can get the Zinc Drink, have zinc on hand. It's already going to be really useful. So either the Zinc Drink or the zinc capsule, whatever we have in the store. Remember, vitamin C. There's a high range when vitamin C is effective. So I would say that, you know, I would think about doing like as an adult would be like vitamin C of like 5,000, 6,000, 7,000 milligrams is what it takes when you get sick. In kids, I wouldn't go super high doses just because, you know, they just have more tender stomachs and ability to tolerate it. But this chewable zinc, like to prevent on kids would be 1 in the morning, 1 at night. If they're sick, just double it. Tell them chew 2 in the morning, 2 at night. Really easily tolerable and it works. Also in kids, this black elderberry syrup works really well. We're out of stock, but we're gonna get 60 in next week. I'm trying as hard as I can to keep everything in stock. Quality elderberry is really hard to come by and there's a lot of shortages. This is my favorite brand. This is what I have at home. This is what my kids use. So the dose for adult and kids is the same, which would be 1 teaspoon twice a day for when you're sick. So this is if you want elderberry by itself. Essential Defense, another option of a herbal combination. And when you're taking it to treat symptoms, it would be 1 in the morning, 1 at night, 1 in the morning, 1 at night. I personally, my favorite out of prevention in here, my first choice is going to be Virus Strike and Zinc. Okay, so if you can get Virus Strike and Zinc in your house right now, either Zinc Drink or Zinc pills, that would be amazing. If we're out of Virus Strike, I would look at Pro-Immuno or Essential Defense as another option. Okay, so those would be what I would recommend. And for kids, we just went through, it's going to be the black elderberry syrup, the Zinc Drink or the Pro Zinc will be really important, and chewable vitamin C to prevent symptoms in children.
Lupus, lung fibrosis,
Hashimoto's thyroiditis,
fibromyalgia, AS, which is a form of arthritis,
Epstein-Barr,
extremely fatigued,
pretty much 0 joint pain.
Much more happy.
I don't have brain fog anymore.
how much weight I have lost.
I want to say remission.
Maggie and her approach is very different than the traditional doctor.
I'm a totally different person.
I got a better understanding of what those intolerances were.
You're not alone.
The community is, I'm learning from everyone else's issues.
It's not just helped me, it's helped my entire family.
We are transformed.
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 Join the movement and transform your autoimmune naturally today.